everyone, and welcome to Health Live at Seniors today. We're going to be having Dr. Pankaj Maheshwari from Fortis Hospital. We welcome Dr. Pankaj Maheshwari, who's a senior consultant and a very senior urologist. He's practicing at Fortis Hospital, Mulund, which is in Mumbai. Before I go to him, I will introduce Dr. Maheshwari. Dr. Pankaj Maheshwari, as I mentioned, is at the Fortis Hospital, an MBBS and an MS from GMC Nagpur, and a DNB and MCH from in urology from the Grant Medical College in Mumbai, with eminent teachers like Dr. Percy Chibber and Dr. Madhav Kamath. Those of you who follow the Health Live series regularly know that Dr. Percy Chibber has been here at least a couple of times. He's written a cover story for Seniors today. So Dr. Pankaj is also an FRCS from Glasgow. He's a pioneer in the use of the holmium laser in India and trained in holmium laser prostatectomy with Dr. Peter Gilling in New Zealand. He established the holmium laser in 1998. He has to his credit 75 publications in national and international journals with an RG score 31.42, which is 56 in index journals. He's the co-editor of the Atlas of Endourology and USI's Clinical Urology. He's authored 10 chapters in different urology books. He's a recipient of the Society International Urology Traveling Fellowship in 1999. He's a member of the editorial board of the Indian Journal of Urology and on the review panel of more than 20 national and international urology journals. He's a recipient of the Best Reviewer Award for the J. Enduro and IJU. He's honorary treasurer of the Urological Society of India, which was in 2023-25. That is currently. He's an ex-treasurer of the West Zone chapter of the USI, and he is a past president of the Lions International. I don't know how you managed to do all these things, doctor, but amazing. And welcome to
Thank you, sir.
Health Live.
Thank you so much. I'm really honored to be part of this group and hope we can have some fruitful discussion.
Doctor, the topic that we wanted you to speak about today was UTI, which is urinary tract infection, and urinary concerns in seniors. Now, one of the things that we do on the Health Live series, which we've been running for since June 2020, is we keep taking the feedback from our regular attendees. And one of the things that they keep asking for is sessions with urologists. So almost every 4 to 5 months, we've been inviting somebody to speak about various issues, whether it's kidneys, whether it is urology, etc. So this is an issue which is very important for all of us, and as you know, for senior citizens especially. So over to you, doctor. Doctor is not going to be making a presentation because we've done quite a few sessions on this. So he's not going to be making a presentation. He's going to speak about it. And then those of you who have questions, please put them in the Q&A tab. And as always, I will take them and address it to Dr. Maheshwari. Just 2 things. Just remember to mention your age and your gender. And do remember that this is an advisory session. If you ask very specific issues with specific medicines, etc., we may not necessarily be able to address them to doctor. And even if he does, remember that there's nothing better than having a clinical in-person session with your doctor. So that is always of preference. This is finally advisory in nature, and you should consider it as that. Over to you, doctor.
Thank you, sir. I really appreciate that you have taken urinary tract infection as a topic for discussion, because believe me, for a urology OPD or for any hospital in general, urinary tract infection is the commonest reason why patient enters the hospital. This is the commonest infection that most people would suffer from. And infections can happen from any time since the time of birth till very senior in age. In children, infection are more common in boys, but after the age of 5 years, infection tend to be more common in women. Now, why do infections really happen? We have to understand that there are some bacteria which are normally present in our body, and they are called as commensals. Now, these are helpful bacteria which really, like some commensals in intestine, also help in our digestion. There are commensals which are present in the urinary passage in the vagina, which prevent aggressive infections. So these are helpful bacteria. But if there is, say, a reduction in immunity, if the person doesn't have enough water, or if there is any disease which causes obstruction to urinary system, this is the time that when these bacteria or any additional bacteria can come in, grow, and lead to symptomatic infections. So why I have spoken about commensals is the reason being, first we need to understand that if your urine report, the ordinary urine report, urine routine is showing bacteria, it is as good as normal. So we do not need to treat every person whose urine report shows bacteria unless the person is symptomatic or has any immunocompromised status, like his immunity is low. Only then we will try to chase these bacteria. Otherwise, just presence of bacteria in urine does not need any treatment. Now, why is infection more common in women? For anatomical reasons, the urinary passage and the vaginal passage are very, very nearby, and the rectal passage is just behind. So there is always infection around the rectal passage. It is possible that that infection from there comes forward and comes in the vaginal passage, and from there further come forward and comes in the urinary passage. Uh, Also, because of the sexual function, there is likely to be infection in the vaginal passage that can come in the urinary passage. So infections normally start either in the rectal area or in the vaginal area, and from there come to the urinary area. Bacteria tend to grow up in the or rise up in the urethra. The urethral tube in women is very, very short. Once they reach the bladder, if our immunity or if our resistance is low, then these bacteria tend to grow in the bladder, multiply, and then cause trouble to the person. Now, infection in men is not very common. Okay, if any man gets infection, it is always considered as a complicated infection and it needs detailed evaluation. A lady getting infection, occasional infection, can be considered as anatomical or maybe not that complicated. Only if a lady gets more than 2 infections in 6 months or more than 3 in a year, then it is considered as a complicated infection, and that is the time she needs detailed investigations. But occasional lower tract infection that happens in a lady can be treated symptomatically or by antibiotic and does not warrant detailed evaluation. Now, this infection from bladder can go up in the kidneys. In kidneys, one more source of infection could be a bloodborne infection, where infection anywhere in the body can come into the kidney. So, the urinary tract infection is a broad term. We will further divide it based on where exactly this infection is. So, if it is in kidney, it is called as pyelonephritis. If it is in the bladder, it is called as cystitis. If it is in the urinary tract or the outflow tubing, then it is called as urethritis. So cystitis or bladder infection is much more common. Pyelonephritis or kidney infection is rare, and usually it is more severe. So depending on where the infection is are the different nomenclature, and also depending on where the infection is would be the different trouble that the patient has. If patient has cystitis, patient would need to go to urine more frequently. They will not be able to hold urine. They will be burning while passing urine, pain while passing urine, may have lower abdominal pain, may have fever. If there is kidney infection, then there would be some flank pain associated with nausea, vomiting, fever, may not have burning in urine because the infection is higher up. So depending on where the infection is, the name is different and patient's trouble is different. Now, let's come to senior people. Why do infections happen in senior citizens? Again, the reasons for infection in senior citizen in men and in women will be different. In women, there are some hormonal changes that happen post menopause. Now, because of these hormonal changes, the level of estrogen or the female hormone, it goes down. When the level of female hormone goes down, the pH of the vagina becomes more acidic, and in this acidic pH, more bacteria tend to grow. So it is because of the hormonal changes that happen, because of the hormonal changes leading to changes in the vagina. This is sometimes called as age-related vaginitis, and because of this, then you have bacterial growth there. And as I have said, once the bacteria come in the vagina, from there there is a possibility that they go up in the bladder. So in women, the most often cause is the age-related post-menopausal changes that happen, which are hormonal changes. Now, in men, the reason could be because of obstruction to the urinary system. And the commonest obstruction that happens in men is prostate. If you all know, prostate is a gland. It is basically a male sex-related gland, which is present in the urinary passage. Our urine outlet tube it goes through the prostate. In every man, the prostate will start enlarging with age. So the normal prostate size is around 18 grams. After the age of 40 years, the prostate starts enlarging. And as the prostate enlarges, the outlet tube which goes through the prostate can get compressed in this enlarged prostate. And that is why it will cause obstruction to the emptying of the bladder. If the bladder doesn't empty well, there will be urine which stays in the bladder. In this urine, again, wherever there is stasis of urine, you will have bacterial growth and infections. So a man getting infection, the commonest reason is bladder outlet obstruction that most often happens because of prostate. Now, what do you do once you have infection? As I've already said, we know the trouble. The trouble will be burning in urine, increased frequency of urine, pain while passing urine, may have blood in urine, may have lower abdominal pain, may have fever. If there is associated diabetes, which is again very common with age, diabetes reduces our immunity, and hence these infections tend to be more severe in diabetics. Okay. So once a person has infection, the person needs detailed evaluation, a clinical assessment by a doctor, and based on how severe the infection, your doctor will treat you with necessary antibiotics. If there is severe obstruction to the urinary outlet, even that would be treated. Remember, in today's time, prostate does not always need surgery. Prostate can be very easily treated with medicines. There are many new treatment options which have come up. One is called as Resume, which is a steam-related treatment. Second is called as a Urolift, wherein you can put some, say, compression devices in the prostate, which would compress the prostate so that the passage between the prostate improves and a person is able to pass urine better. So multiple non-surgical treatment options are available, which will reduce the obstruction to the bladder. The bladder will empty well, and we will not get infection. Now, suppose your doctor tells you that you need a urine test to be done. How should you be collecting urine? Now, this is extremely important. If I can just convey this small part to you today, this session should be considered as an absolute success. A common myth is the moment a person is asked to collect urine, they get up early in the morning and give the first morning sample for urine. Now, remember, we do not need morning sample. Morning sample is needed in some specific diseases like tuberculosis. There was a time when tuberculosis was very common, and hence all men or all patients needed a morning sample. Now TB is not that common, so you do not need a morning sample. What you need is a fresh sample. If you keep a bottle of urine on table for 4 to 6 hours, in that bottle always there will be bacterial growth. Remember, for bacterial growth, what do you need? You need water, you need temperature, you need proteins. Now, in a bottle of urine, there is all three things are there. Obviously, urine has water. Urine is called urine because it has urea. Urea is a protein. And in our city of Mumbai, the temperatures are such that if you keep a bottle full of urine for a couple of hours on the table, in that temperature, the bacteria will definitely grow. So whenever you are asked to give a urine sample, you should go to the lab. Do not call anybody at home to collect the sample. Go to the lab who themselves do the test. Do not give it in a place which sends to somewhere else, because in transit it is possible that sample is not well preserved. Before giving the sample, in men, the foreskin should be retracted, penis should be cleaned with soap and water, pass 50-60 ml urine, and then 10 ml to be collected. The initial and terminal urine should not get collected in the bottle. In women, say, open up the vagina between two fingers, clean that area with soap and water, again pass 50-60 ml urine, and then 10 ml to be collected in the bottle. So the important things are, it should be a fresh sample. It should be a clean catch, means either you retract the foreskin and clean, or clean the vaginal area well. And it should be a midstream sample. So do not collect the initial or terminal part of urine, just the middle 10 ml to be collected. And the last and most important thing is, it should be a fresh sample. So don't collect a morning sample, go to the lab and give the sample there. If you collect the sample properly, only then that sample's report has any meaning. We recently did a study at Fortis Hospital where we looked at samples that were collected outside the hospital, and we just asked the patients what instructions were given to them before sample collection. It was surprising and shocking that more than 90% patients did not know how to collect the sample. That means more than 90% samples were poor samples, And if we start treating patients based on such poor samples, obviously we will be overusing antibiotics, and our treatment may not always be perfectly correct. So collecting proper sample is very, very important. Number two, a lot of people are in a habit of taking antibiotics on their own. Means it is not uncommon for me to have a patient in my OPD who says, Doc, I had burning 10 days back. 2 years back, I had met a doctor who had given me XYZ prescription. Because the trouble was same, I repeated the same treatment. Never do this. Okay. The treatment that was given 2 years back may not be applicable today. The cause may be different. And once you have started antibiotics, then for me to investigate the cause of that infection becomes very difficult. If I don't know the cause, obviously I will just be treating your infection and not the cause. If I don't treat the cause, you will form the infection again. So in emergency, take some anti-inflammatory, take some urinary alkalizer, but don't start antibiotics on your own. If you are hard pressed to start antibiotics before reaching the doctor, then at least collect a sample and refrigerate it, or send it to the lab for urine routine and culture, so that when you go to the doctor, you can say that, okay, this is the sample I've taken, which was done before I started on antibiotics. So this is second important message that I want to give you, that do not start antibiotics on your own. Do not start antibiotics based on what prescription was given to your brother, father, uncle, or anybody. Every patient is different. Treatment for every patient is different. Now, you may laugh when I say that do not take the prescription of your mother, father, but this is what we commonly see. People have a inertia about going to doctors, and they would feel कि ठीक है यार, फादर को भी सेम तकलीफ थी तब गोली ली थी, अभी सेम गोली हम भी ले लेंगे. ऐसे नहीं होता है. Every person is different and treatment needs to be individualized. Now, as I've already said, if there is a lady with one episode of infection, all I'll do is treat her with antibiotics, one episode, observe her. Only if the infection is repeated, then do a detailed evaluation. But if a man comes with infection, then he needs detailed evaluation, which will include a thorough clinical examination, a sonography to look for any cause for bladder outlet obstruction. We may do a blood test, which is called as a PSA test. We may do a uroflowmetry test, which will tell us how much is the obstruction, and then treat the person. Now, let's look at few myths related to infection. One common myth that women have is that if I go to an unclean bathroom, I get urinary infection. Now, remember one thing, urine is a waste product of our body, and any waste product is better out of our body than inside our body. So if you try to hold urine, you are keeping this waste product in your body, and hence the risk of infection probably may be higher. It is important not to hold urine. A dirty bathroom cannot cause urinary infection, because for urinary infection to happen, the dirt should come in contact with your interior organs, which doesn't happen. A dirty bathroom at best can cause skin infection, but not urinary infection. So if you are going to a public place where you feel that bathrooms may not be clean, it is a good idea to carry some tissues in your purse, clean the seat of the bathroom, maybe use some antiseptic spray and then use it, rather than trying to hold urine and increasing the risk of infection in yourself. So unclean bathrooms do not cause infection. It is the act of holding the urine which causes infection. The second important thing I want to tell you is that, you see, when you have, say, post motions, when you try to clean yourself, the water should go from front to back and not back to front. There are some commodes which have a fixed faucet behind. Now, when you try to clean yourself on such faucets, the water comes from behind to the front. In this way, what would happen is the rectal dirt will come towards the vaginal area, and the risk of infection will increase. There are few sexual precautions that are important, and because that will help you reduce the risk of infection. One is, do not try to clean yourself after sexual activity. The act of cleaning increases the risk of infection. What needs to be done is, post sexual activity, pass urine, change the inner garments, and that is all is needed. No specific cleaning is needed. These days we see a lot of advertisements of antiseptics which come on television. Please do not use any such antiseptics. These antiseptics will destroy the commensals in the vagina and increase the risk of infection by virulent bacteria, by dangerous bacteria. So no chemicals to be used, just standard hygiene, changing the garments twice. Do not try to hold urine. There should be no constipation. And post motions, when you clean yourself, the water should go from front to back and not back to front. If we do these simple precautions, the risk of recurrent infections will dramatically reduce. Try and control diabetes. Diabetes is a very, very important reason for infection. Diabetes makes you prone for infection. Further, in men as well as in women, diabetes will weaken your bladder. So even if there is a partial obstruction with a weak bladder, you will not be able to empty yourself well. Urine will stay in the bladder, and the urine that stays in the bladder would be a source for repeated infection. So strict control of diabetes is important. Not only it will prevent infections, it will prevent progress of infection, and it will, keeping your bladder healthy, will prevent recurrent infections. So further, in men, diabetes can cause infections around foreskin, and many times that can be a source of repeated infections. So strict control of diabetes is extremely important. So if I have a male patient who comes with repeated infections, I will say increase your fluid intake. Again, do not try to hold urine. Strict control of diabetes. There should be no constipation. And if there is associated prostate enlargement, that needs to be treated well. You may have a patient who has culture test done for some other reason, comes out to be positive, but patient does not have any trouble. Now, unless the patient has severe urinary trouble, antibiotics are not needed. So don't jump to use of antibiotic the moment there is any burning or pain while passing urine. So this is about UTI. Again, to summarize, if I have to give few messages, hygiene very important. Strict control of diabetes important. Do not try to hold urine. Go to urine whenever you have a sensation. Whenever you give a sample, it should be a proper mid sample. There should be no constipation. And post cleaning, when you clean post motions, the water should go from front to back and not back to front. And few basic sexual precautions if they are applicable. If you follow this, the risk of infection will dramatically reduce.
So there's a question about from Mr. Vinod Dadlani. What about excess urination but normal quantity or more? Is it UTI?
No, the amount of urine depends on how much water you drink. Okay, so while answering, I'll not use the phone.
Yes.
So the amount of urine depends on how much water you drink. Okay, so if there is excess urine production, keep a watch whether your fluid intake is very high. If fluid intake is high, you see how much water does a person need to produce adequate urine? To cleanse your system internally, you need around 1.5 liters of urine. So beyond this, you will need around 500-600 ml, which is for our metabolism. So we definitely need 2 liters of liquid a day. Further, it will also depend on how much spend we do, depending on our exercise and the heat and temperatures. So in summertime, what you need is probably 2.2, 2.5 liters liquid. In wintertime, 1.75 to 2 liters liquids. Anything more than this you take is going to produce more urine.
The question that you had raised was excess urination, but normal quantity or more, and you mentioned the amount of.
So if you drink more water, you will definitely produce more urine. So whenever urine volume is higher, there are two things that I would first see. One is how much water is the person drinking, and second would be there are some drugs which patients get which produce more urine. Like many times your physician may give you urine producing drugs like Ditor or Lasix, which is given to control blood pressure or for your heart disease. And these are drugs which will produce more urine. Otherwise, the urine production will completely depend on how much you drink.
All right. Doctor, there's a question from Mr. Vinod Dadlani about is it a good idea not to drink water at night before sleep?
Okay. So a lot of patients are troubled by nocturia, means they need to get up multiple times at night to pass urine. Okay. Medically, we would say that up till twice is acceptable. If it is more than twice, then it is really, it spoils the quality of the life. Because if you don't sleep well, you would be tired full day, you would be sleepy during the day. Now, if you are bothered by getting up multiple times at night, there are a couple of things that you should do. Try and keep a gap of 2 hours between dinner and sleep. So if I'm going to sleep at 10, then I should start my dinner at 7:30 so that dinner gets over by 8. And between 8 to 10, reduce as much liquids as you can. Lot of people are in a habit कि मुझे सोने के पहले दूध चाहिए, सोने के पहले पानी चाहिए. Don't have this habit. If you drink just before going to bed, you will need to get up multiple times at night. Again, there are people who are in the habit of drinking water whenever they get up at night to pass urine. Now you are increasing your problem. As it is, you are producing more urine at night, and if you drink more water whenever you get up, that problem gets exacerbated. Again, a lot of senior people have this issue of excessive snoring. Now, if there is snoring, there is something associated with which is called as sleep apnea. And because of sleep apnea, a person tends to produce more urine at night. So ask your partner or somebody at home whether you have excess snoring. If that is there, that should be corrected. That will also help you reduce getting up at night. And last thing is that there may be some swelling in your legs. If there is swelling in your legs during daytime, because we are standing, the legs being dependent, the water gets collected there. When at night, when I sleep, because of again the gravity is no longer playing, so that water tends to come back in my system and I produce more urine. So if person is getting up multiple times at night, reduce liquids evening onwards, merely stop liquids in last 2 hours of the day. Do not drink liquid whenever you get up at night to pass urine. If there is mild swelling on the legs, either use a tight, socks, or keep your legs elevated, and avoid taking drugs which produce more urine like Lasix or diuretics evening onwards. If you take these precautions, your nighttime getting up will reduce. If it still persists, then there are medicines which will reduce nighttime getting up.
Thank you. We have a question from Mr. Anil Kumar Chopra, who's 74. He says his prostate size is 53 cc. PSA level is 1.02. No urine infection, only residual urine is around 38%. Urine flow highest 18-19. Need your advice.
So you are doing absolutely perfect. You need nothing. Okay. Remember, we don't treat prostate size, we treat patient's trouble. As I told you, the urine outlet tube goes through the prostate. So if the prostate grows outwards, it may grow to 100 grams without causing any trouble. If it grows inwards, it can compress this tube and cause trouble to you. So I am not going to give any weightage to 53 size prostate gram because that is immaterial. The treatment decision does not depend on 53 cc prostate size. PSA of 1 at the age after 60 years, that means the risk of prostate cancer in this lifetime is negligible. So if PSA is more than 2 at 60 years, then a person needs a regular follow-up. But if you have at nearly 70 plus, if your PSA is just 1, then you do not have risk of any major disease. Do not give too much weightage to residual urine. You see, there are many factors which can lead to residual urine. One of the most interesting experience I had was, I had one senior doctor who came to me as a patient, and I was just staring at his residual urine for a couple of seconds more than what I would normally do. And he told me, Pankaj, don't look there. बाथरूम इतना गंदा था कि इससे ज्यादा यूरिन करना पॉसिबल नहीं था. कहने का मतलब there can be many factors other than the urinary factors which play a role. Just the stress that you are undergoing test, you may not pass urine well. You may have drunk excess liquid for sonography, so you produce urine between your passing urine and the time when sonography is done. The bathroom may not be familiar. There may be people around, so you don't pass urine well. So don't give much significance to residual urine also. And your flow rate is perfect. Anything more than 12 ml, I would be very happy. Your flow rate is 18 to 19 ml per second. So that is absolutely acceptable.
Thank you. We have a question from Shailaja Ganguly, who's 73. She says, Doctor, you spoke of an anti-inflammatory tablet before resorting to antibiotics. I was told a drug like Comiflam should not be taken in a single dose. We should take at least 10. How valid is this?
Oh, definitely you should not take 10. Anti-inflammatory is a symptomatic treatment. Means if I have a headache and I take one tablet, I am not expected to continue the headache tablet just because there is a course once the headache is gone. So same way, anti-inflammatory is a symptomatic treatment. So as long as I have trouble, I would take the treatment. The moment trouble stops, I will stop the treatment. And this is a stopgap arrangement till we reach the doctor. So say tonight somebody has trouble. Obviously, you may have difficulty meeting me tonight. You will meet me tomorrow morning at 10 a.m. in my OPD. So to keep yourself comfortable tonight, take one tablet of Combiflam. Maybe repeat it after 8 hours. Take one urinary alkalizer. Tomorrow morning we'll see you, we'll evaluate and start specific treatment.
Doctor, there's a question which has come from an anonymous attendee. Doctor, you mentioned about not holding urine for too long, but in cities like Mumbai and Bangalore, we have huge issues about traffic. What do we do then?
Now, this is a problem. You see, now all I can say is that if you are expecting yourself to be stuck in traffic or maybe on road for more than 2 hours, then at least 2 hours before embarking on that journey, reduce liquids. Before getting in your car or your transport, use the restroom. And if you have not drunk enough and if you have emptied yourself before getting in, hopefully you will be able to reach your destination. If it's your personal car, I would say it's not a bad idea to keep a urine pot in the car. Instead of trying to hold urine and trouble yourself, just use your urine pot and you can clean it the moment you reach home.
All right. Doctor, there's a question from Katie Dadanchi. The first part of the question we've answered. If I have a few pus cells in the urine, what should be taken to remove them? She's 73.
Excellent question, madam, and I thank you for asking this question. This was one part I thought I would talk on, but I missed it. Do not chase pus cells. Okay. First and foremost, understand that I do not want to call it pus cells. The moment I call it pus cells, I get a feeling that pus is equal to infection. So these days, I don't call them pus cells, I call them WBCs. Because WBCs can be there even as a phenomenon of healing. So any patient who has had a catheter, any patient who has had a surgery, any patient who has had some instrumentation, there would be WBCs in urine for a very long time. They may continue for 2 to 3 months. In diabetic patients, there may again be WBCs in urine without there being infection. So do not chase WBCs. In women, up till 5 WBCs can be considered as normal. So again, unless the sample is collected properly, unless the patient is symptomatic, I would not chase WBCs. So not 2 to 3, even if there are 50 WBCs in a patient who is absolutely asymptomatic, I would not chase it.
Right. Thank you. Doctor, we have a question from Mr. Umesh Kuncharkar. He says, I'm 70-year-old and a diabetic. My sugar level is under control with 110, 145. I'm attending office even today for at least 7 to 8 hours. His question is, what is your advice? How much water should I drink at every interval?
Okay. So partly I have already answered this. You have to first calculate based on your lifestyle, how much liquid do you need? So now let me take my example. I'm in an air-conditioned office. I traveled in an air-conditioned car. I do exercise, but I'm not too much in sports, which happens in, say, heat. So my sweating is very, very less. Now, in this time, when it is not very hot, my loss through sweating would be low. My insensible loss maybe will be around 400-500. I need around 1500 ml urine and 500 ml for my metabolism. So I need total 2 liters. Now I am awake for approximately 18 hours. So I need to divide these 2 liters over 18 hours. So what I would do is 250 ml every 2 hours of any liquid, and last 2 hours of the day, stop liquid so that I do not get up at night to pass urine. So morning 6 a.m. I have a cup of tea. 8:30 I have one more green tea. Around 10 o'clock, I have a coffee once I reach hospital. Then maybe at 1 o'clock with lunch, I may have some liquids. 3 o'clock, again a cup of tea. So that way, 250 ml of any liquid every 2.5 hours and every 2 hours, and that should suffice. You do not need any extra water than this. But in contrast, say if somebody is working on the say farms, has a lot of sweating, or somebody is into sports, jogging, running, marathon running, obviously their requirement of water will be much more than what would be for you and me. So first and foremost, you need to decide how much liquid you need, and then divide it at 2 hourly intervals over say 18 hours.
Right, absolutely. If you are into sports, then you need to be careful of that. Doctor, we have two more questions. One is from Mr. Rajiv Kumar. His PSA is 2.52. He has frequent urination, urinary incontinence. He has an enlarged BPH. He was prescribed Siluracil 8 mg OD. Please advise how long can this be taken, Siluracil, and what are the side effects? Are these side effects reversible?
Okay. Now, if indicated, psilocybin can be taken lifelong. Okay, so it's a very, very safe medicine. All these prostate medications have started. They are extract of a blood pressure medication which was taken lifelong in full dose by patients. So when the full dose was taken, extract of that can definitely be taken. So long-term safety, absolutely good. So this decision will be based on how much trouble you have, and your doctor will decide how long you need to take it. But if one tablet gives you response to your prostate and avoids a surgery, then it is safe to take this tablet lifelong. Second, side effects are predominantly in the initial part of this medicine. So when I just start the medicine, initially I may have some giddiness, I may have some nasal stuffiness, I may have excessive tiredness, but over days, all this trouble subsides. Few people have sexual side effects, means their ejaculation stops. Frankly, stoppage of ejaculation has no significance. If the erection is good, sexual function is possible. Even if nothing, no ejaculate comes out, should not bother you. So overall, these are very safe medicines, and if they give you response, can be taken long term.
Right. Doctor, one last question which is there. Is it from Prem Bhushan Gupta? Is it better to take warm water the whole day?
It is important to take water. Now, whether warm, cold, or in what format is completely your choice. Finally, we have a system by which even if I take ice cold water, my core temperature will increase the temperature of that water. Okay. So whatever you feel comfortable, take that. Now, people like me who always have throat issues, I definitely like warm water, but it is not necessary from water point of view. It is from other reasons.
Doctor, you've given a very detailed account of what in UTI and what other urinary issues entail. Some of your points that you made, especially about urine tests, were amazing, and I think the message has been driven home loud and clear. For all of you here, remember that this video, the edited video, will be up on the Seniors Today website on Monday evening, and you can have a look at it along with the takeaways, which are as always written by a medical practitioner. So you can refer to that. You can refer to doctors, all his advice. Once again, when we have the site up, when we have this video up, we will be back once again next Saturday at 5 p.m. with another session of health webinar. You can pre-register as always. Thank you very much, Doctor, for being here. And despite this technology hitch, and I do know that there were patients waiting for you. Thank you to the team at Fortis for facilitating this. Even as we bid goodbye to you, Doctor, we would like to just place a video of our last 56 issues of the magazine. Seniors Today comes out as an e-magazine every 15th of the month, and we've been there since July 2019. Yes, can you? Thank you. Thank you very much. September or October 2020 was when we had the cover story written by Dr. Percy Chibber, Dr. Maheshwari. So
Right.
you would,
I think you are doing a great job. It's fabulous, and I was so impressed by your covers. All my favorite people were there on the covers. Uh, Anytime you need any urological help, you can reach out to me. There is a lot to discuss. We can talk about BPH. We can talk about prostate cancer. These are issues about senior citizens which need to be discussed and which we need to be talked about. I would love to be part of this event.
Thank you very much, Doctor. Thank you very much for being here. And as I mentioned, we will be back once again next week, which is on March 2nd. And we have a session on the dental treatment. So we will be coming with that, and see you then. Thank you very much once again. Thank you.
Thank you. Thank you.
Subscribe now and press the bell icon. Never miss an update.